Welcome everyone to Top Tips to Improve Your Writing. This is another conversation about writing, and I'm here today with Helen Lewis, who is an English teacher. Hi.
Hello, Vicky.
And in today's episode, we're going to be talking about punctuation. Um,
Mhm,
yeah, so
mhm,
I'm an English teacher. I teach adults, and I'm particularly interested in on how we improve our writing. Um,
mhm. Yeah.
And Helen, maybe you can give us a quick introduction, tell us what you do and why you're here.
Yes, thank you, Vicky. So I'm here because I teach healthcare professionals who have English as their second language or additional language, and we have to prepare them so they're ready to do the writing subtest of the occupational English test. And punctuation is something that sometimes comes up in writing, so that's why we decided to make a video about it.
Yeah, great. And I know that you are particularly an expert in punctuation. So today I'll be interviewing I'll be interviewing you, Helen, and asking you what are some of the top tips that people can do, especially to improve their writing in the OET
Mhm.
exam.
Brilliant, thank you. Let's get into it.
So punctuation,
Mhm.
I was looking it up, and it was punctuation was actually invented in Greece,
Mm.
and it came into writing because it was a way of structuring writing.
Mhm.
Um,
Mhm.
so
Mhm. Right,
I like to
right.
think of it as you know, telling the reader when to pause. A
Mhm.
little bit like if you imagine the lines on a road, you're driving down a road,
Mhm.
and
Right.
if there's a
Yes,
dotted line, you can cross. If there's a straight
right.
line, you need to stop. So it's a little bit similar with punctuation in writing. You know when to pause, um,
Mhm.
you know how the sentences are connected together.
Yes, exactly that. And I think the main reason that punctuation helps is it helps the reader to make sense of what they're reading, how ideas are connected to each other. And we'll be talking about clauses today, which is like mini sentences within a sentence. And they're really important to get right and nicely organized to help the reader. And in this case, another healthcare professional. So yeah, that's our road analogy.
Great. And today we're not going to focus on all the punctuation, but we're going to focus on the main four.
Yes.
So the full stop, the comma,
Yes.
the
Yes.
colon, and the semicolon.
Oh, yes. Thank you. Yes. And these are punctuation points that tend to get confused. People tend to either forget them or not use them accurately. So I hope by the end of this session, our viewers will feel more confident knowing how to use these four punctuation marks.
Absolutely. So we'll start with a very important one, which
Mhm,
is the full stop.
mhm,
So
mhm.
yeah, tell us about this one, Helen.
Okay, the full stop is used at the end of a declarative sentence, such as Mr. Britton presented today with chest pain, full stop. It can also appear after an instruction, for example, please ensure Mr. Britton takes adequate rest. It's just a way of closing out either a declarative sentence, which basically means not a question, and it can also show us that an instruction or a command has been given. Now, American viewers may know this punctuation mark as the period. It's also called that, but as we're both British, we'll go with full stop.
Yeah, great. So
Thank you.
have a chat about some of the common errors that people make, especially in the exam,
Mhm.
with the
Yes,
full stop. Um,
yes,
the
right.
first one here is legibility.
Absolutely. Legibility means clarity, that you can read the mark, that it is legible. And there are three problems I've seen when I've marked students' submissions. And one of them is simply putting the full stop on the line itself, also making it a dot, not like a dash. And a tip is to make sure you use a sharp pencil, okay? And in the OET, they ask you to use 2B pencils. And they even say have some spare sharpened 2B pencils for writing. And the reason for this is for those taking the paper-based test, you'll have been using your pencil throughout 2 hours of exam time, the reading and the listening before then, and shading in things. So you want to have a nice sharp tool to write with. So that's a little tip for the test.
Oh, nice. That's a good tip. Lots of pencils rather than trying to sharpen it in the exam.
Yes.
Um, and the next
Mhm.
common error I've definitely seen with lots of my own students who work in the workplace,
Mhm.
because I know it's
Mhm.
different in different languages.
Mm-hmm. Exactly. So the correct use of the full stop is as a decimal point, and the incorrect use is above. Here, she has a low grade fever, 38,2 degrees C, and the correct one is where the full stop is used. It's actually then called the point, decimal point, but it looks the same, it's still a dot. And I think this problem tends to come up more for people from European countries with that writing system. I've seen people with Russian as their first language doing a comma instead of a full stop. So that's just another small thing to be wary of.
Yeah, and it's important, right? Because it changes the number. And I
It
know
does.
in Spanish it's the other way round.
Okay.
So you use a comma for a decimal instead of a full
Right.
stop like in English.
Right.
Yeah.
Right.
Um,
Exactly. So
um,
that.
the other difficult thing is when can I leave it out? So tell me when
Mhm.
can I leave out the full stop and when can't I?
Sure. So as it's shown here, for Latin abbreviations like EG and etc., you would use it there like E dot E full stop G full stop. It's not a full stop; it's just the dot really for for the abbreviations. But OETs say that for titles such as Mr., Mrs., Ms., any of those, you can omit it. So I would just say remember that you should use it for the words or the abbreviations, etc., and for example, e.g.
Ah,
Mm.
interesting. Yeah.
Mm.
I always write Mr. and Mrs. with the dot, but
Yeah,
nice.
strictly speaking, perhaps, yeah, that is the way to do it because it is an abbreviation of the word Mr. or Mrs. or Ms. So I think technically it's correct, but OET, according to their website, say you don't need it. And my advice is if you can omit something, make life easy for yourself.
And faster for your writing, yeah.
Absolutely, yes. So OET also say for medical abbreviations, you can
Mhm.
write with or without the full stop. And there are some examples which are taken from the NHS patient-facing page. So, for example, BDS could be written B.D.S, or it could just be written as three letters together. You probably can guess what my advice is on this one.
Just admit
Omit
it.
it. Omit
Yeah,
it. Yeah, make life easier for yourself. You can omit it.
great. That's so useful, Helen. Thank you.
You're
We're
welcome.
going to move on now to the comma.
Mm-hmm.
So I've got
Mm-hmm.
two sentences here, and I'm going to
Mm-hmm.
just read them out loud, and then you
Mm-hmm.
can tell me what to remember with the comma. So
Mm-hmm.
the first sentence, if I read it, let's eat, Grandma.
Mm-hmm.
And in the second sentence, let's eat, Grandma.
This is actually a really famous example. So, what's the difference? If anyone who is watching can imagine, what's the difference? In which one does grandma survive? So, the second one, grandma is the meal, and there's no separation between the verb and the object grandma. So, it's the same as saying, let's eat toast, let's eat a burger. But in the first one, it's talking to grandma, like, Grandma, let's eat. So this is a useful one to remember. And I think we've got some
Yeah.
more examples of this as well.
Yeah, definitely. So yeah, the comma is very important.
Mhm.
And it's yeah, the reason is we're separating the clauses. So can you tell us a little bit
That's it.
about separating
Yes,
clauses?
exactly. Thank you. So in the first, I'll read the first one. Although Mr. Fry has decreased his BMI to 24.5, comma, his fasting blood sugar is still high, full stop. So here, the first clause or mini sentence is about the decrease in Mr. Fry's BMI. And it's what we call a subordinate clause. We're de emphasizing it. And the word there is although, which is saying this has happened, but it's not the most important thing. And the most important thing, the main clause, comes afterwards, which is his fasting blood sugar is still high. So when we have a subordinate clause, we put a comma afterwards, and then we have the main clause. And if we go back to the idea of roads and road markings, it's a way to separate out. I think this would be quite a strong line, actually,
Yes.
because it would be really like a thick line or maybe a line with very few spaces.
Yeah.
And then, yeah, the second one, if I read it now, Mr. Fry has had type 1 diabetes, comma, which has been managed with metformin, comma, for 3 years. So here we've got something called a relative clause, which is given by which has been managed by metformin. And that is modifying, giving more information about type 1 diabetes. And I quite like that because this pattern, because you can slide in a little bit of extra information, but it's not the main point of the sentence. The main point of the sentence is something else. What would you say the main point of that sentence is, Vicky, for the second one?
The main point is that he's had type 1 diabetes, and then
Yes.
you've got
Mhm.
extra information, and you're using
Yes.
which to give that extra information. Yeah.
Yes.
Uh,
Yeah, I would say
well,
that the
in
writer,
fact, it's
yeah.
Mr. Fry has had type 1 diabetes for 3 years.
Mhm. Mhm.
And then
Mhm.
obviously with this kind of relative clause, I see lots of my students make mistakes as well. You need two commas,
Right.
that goes around that extra bit of information in the middle.
Right. I'd say it's like a lifting device, like it lifts up that relative clause. Because the sentence could work if we just said, Mr. Fry has had type 1 diabetes for 3 years. That would work. Yeah.
Yeah.
All right.
And I mean
Yeah.
these ones it's great to just remember which words you're using them, right? So if you're using which to add
Yes.
extra information, then you want commas. And if you're using
Yes.
although, then you want a comma.
Yes.
Yeah.
Right. Right.
Um,
Exactly.
Another way to use a comma is in a list.
Indeed, yes. And we're going back to the unfortunate example here. Um, we have a correct and an incorrect version. So the correct version for commas in a list, he was managed with metformin, comma, dietary modifications, comma, and a referral to a physiotherapist, full stop. So here we've got 3 items in the list. One is metformin, two, dietary modification, and three, the referral. And there's a comma after each one of those. Some people ask me about the comma before the and if you're using British English, you will use it. If it's American English, you don't use that comma there.
Ah,
But
I
it's
didn't
not a big
realize.
deal. Yeah,
Okay.
it's actually called the Oxford comma, as
Of
though
course.
someone in Oxford invented a comma.
An extra comma. Of course they
A
did.
comma for and. I know, it's rather silly. But I don't think this is going to change someone's OET language score particularly. However, if we look at the incorrect example, can you spot the problem? Mr. Fry's hobbies include cooking his cats. Sorry, I'll try it again. Mr. Fry's hobbies include cooking his cats and gardening. Oh
Yeah,
no.
I'm reading this and I'm like, what a terrible
Yes.
man that cooks his
No.
cat.
It's unfortunate, isn't it? So here it looks like cooking his cats is one unit, and he I hate saying this because I love cats. He is someone with a cat in his oven. Terrible. But here's another thing, going on what you said, Vicky, about the kind of words you use. When you have a list of things, it's really helpful to make sure the list is in grammatically similar items. So
Yeah.
cooking is a verb, or it's a gerund. So is gardening. But his cats, it, yeah, is not
Yeah, I mean,
an
technically,
activity.
yeah. So, I mean, it would be more correct to say something like includes cooking, comma, spending time with his cats, comma,
Right.
and gardening. Yeah.
Yes. Nice correction. Nice correction. Thank you.
But yeah, the comma would save the cats here. So make
Yes.
sure we use
Commas
a
save
comma for a
to
list.
save cat. Yes. Commas save cats.
Um, and I know we
Yeah.
talked about common errors, and you
Mhm.
mentioned this one, the introductory linkers. So what's the error that people are
Yeah.
often making?
So these two sentences are correct, and it's using a comma after a time expression at the beginning. It's not always needed. I like it when there's quite a long introductory clause, but here it is. On the 3rd of November 2011, comma, Mr. Fry presented with chest pain. So we're just separating out the clause that gives the date, and in the second sentence, the clause that gives the time period. And it's that simple. The problem is when people don't use it.
Yeah, nice.
It's a
So
nice
nice
simple
one to
one.
remember.
Yeah.
And
Mm.
a last OET example,
Mhm.
for commas.
Mhm. Yeah. So on their website, they've got lots of excellent resources on punctuation. And they say in addresses and greetings, you can omit the comma. So, for example, Dear Dr. Jones, no comma needed. And in addresses, you don't need the comma there either at the end of an address line. And that's really
Nice,
simple,
nice,
I think. Yeah.
nice. So you
Yeah.
can omit it a bit like the Mister one. Yeah.
Exactly. Yes.
Nice.
Exactly.
Okay, cool.
Makes life easy.
Well, we're going to move on now to the two
Yeah.
the colon, which is
Yes.
the two dots, and the
Mm-hmm.
semicolon, which is the dot and then the comma underneath.
Comma. Yes, exactly.
And I know
Yes.
that these are sometimes confusing for people. Um,
Mm-hmm.
so
Yeah.
tell me, when are they both used? When do we use the colon and when do we use the semicolon?
Right. Thank you. So in this example, let's just read it aloud and we'll find how to use them. Here we go. Mr. Fry was prescribed the following medication regimen: colon, metformin, comma, 500 milligrams at night, amitriptyline, 10 milligrams, comma, at night, nocte, semicolon, and 20 milligrams Floridax daily. So we can see that the colon appears just once, and that's at the start of this list of medications. There are 3 medications, and they are separated by the semicolon. So going back to the road analogy, the marks on the road, the colon is like a thicker line saying do not cross, or I'm separating out two things. And yeah, it comes after what could be a sentence. So we could actually just say, Mr. Fry was prescribed the following medication regimen. It could work as a full stop there, but really it's better with the colon, and then we have the list of the 3 medications. Now, you might be thinking, why not just use the comma? Because it's a list. But
Yeah, I always see it as
yeah,
like an introduction, it's
yes,
like saying,
yes,
this is the following list. Well, here it
exactly.
is, and then
Yeah, yeah,
you know that you're going to
right.
read the list.
Right. It's a bit like here we go, right?
Yeah,
Ta-da!
yeah,
Yeah. So it's an announcing uh, punctuation mark.
yes, yes.
Going back to the semicolon is just separating long items in the list because the comma is used to separate out the number, the dosage from the name of the medication.
I see.
Yes. And
Um,
actually,
hmm.
is
So I have a question about this one because I think when I see people's writing, and even in
yes.
my own writing in English, sometimes I understand the difference between the colon and the semicolon, but actually
Hmm.
what I find difficult is
Hmm.
the difference between the semicolon
Hmm.
and the comma. Uh,
Right.
so maybe you
Yes.
can tell me a little bit more about the semicolon. When do we use it? And I also have
Yes.
another slide where we can look at somebody making a mistake with a
Um,
comma.
yes. Thank you. So when we chatted about this earlier, we said the semicolon is the unifier of sentences. So
Yeah.
in the sentence here, it actually looks like there are two sentences next to each other, and they are the patient was advised to adhere to the prescribed regimen,
Hmm.
semicolon. However, comma, non-compliance has likely contributed to the persistence of symptoms. So there's two sentences which are linked, right?
Hmm.
One is about the patient's advice, and then the contrasting sentence that they haven't complied and their symptoms have persisted.
Hmm.
So the semicolon is really used to bring together two sentences that really function as one. And
Hmm.
the writer, when you put that semicolon down, you're using it when you want to almost visually pull together two ideas that are really closely connected.
Hmm.
The other thing to
That's
say,
helpful. Hmm.
yeah, the other thing to say is that you should avoid really long sentences in English where there's a comma and a but and a comma and a so and a comma and another conjunction. So this helps to sort of tighten up your writing and make it have more impact, I would say.
Lovely.
Yeah,
So it brings two linked sentences and it shows the reader these are linked. Yeah,
exactly.
that's very nice.
Exactly. Yeah, it's handy.
And I know with some people that I know that again maybe they write in a different language like Italian or
Mhm.
Spanish. You can use lots of commas and have very very long sentences. So I wanted us to
Ah,
look at an
ah,
example um,
mhm.
of why am I using a semicolon and not a comma in this case? So this is an incorrect sentence
Yes,
here.
yes. So it would be incorrect because we've got um, no connection, no connecting word, I should say, between the clause before the comma and the clause afterwards. So the first clause is saying something about the patient presented with complaints of episodic chest pain. Afterwards, we've got more information about them.
It's like a new
Probably,
sentence. Yeah.
yeah, this would be better as a new sentence, or we take away the word these episodes and say which
Mm,
instead. And then
right.
we know that that's what we're talking about. But yeah,
Yeah.
it is tricky. It's hard. It's a hard one to explain to people, but really what you're trying to achieve is continuity of the subject of the sentence with the verb. And when you get to the word these, it's a little bit further away from complaints. So
Mm,
it's that one of the rules of writing is you try to keep the verb and the subject close together if you can.
hmm. Yeah.
And here it looks like additional information is coming in.
So here
Yeah,
a semicolon would work nicely because you've
yes,
got these two separate sentences, but we know that they
yes.
are linked. Yeah.
Exactly. Yes, there's two
Mhm.
separate sentences, but we know that they are linked.
Yeah.
Yeah,
Yeah.
thank
No.
you.
Great. Thanks so much. I think
Help
that
the
we've come to
reader.
the end. But
Yes.
our conclusion is
Help.
punctuation has a meaning, right?
Yes, it
Uh,
does. Right.
So it's really good to just know, which of the symbols
Mhm.
is used in which way to help the
Absolutely.
reader.
Absolutely. So we get a nice smooth flow of traffic, not just all the words bundled together and not knowing how things are connected and how things are separate. And I'll say that the more you practice, the more you start to notice when to use the various punctuation points. Yeah.
Yeah, I like
Thank
that point on noticing because it's also about, practicing in your own writing, noticing when you're reading. That's
Absolutely.
really, really important. Great.
Absolutely. Yeah.
Thanks
And I
so
think
much, Helen.
thank you. Yeah, thank you, Vicky.
Yeah, thanks so much. A really, really nice and interesting conversation about punctuation. And I think that this would be useful also for other people that I've met that are taking an
Mm,
IELTS exam, especially for exams, or professional writing where you need to be very
mhm.
highly correct.
Yes.
So yeah, if you want to hear more from me and Helen about writing, you can
Yeah.
get in touch. And if you have any questions of things that you would like us to explore in these conversations,
Mm,
do tell us. And we really, really love to be here talking about writing with you. Thanks,
thank
Helen.
you, Vicky. Thank you. Thanks for watching, everyone.
Bye. Hey. Thanks, Helen.